Dr. Gulani, though, I want to ask, can you walk us through, when we're talking about patients with a lot of different kinds of conditions. I assume that there are some patients for whom telehealth may not be appropriate. I'm thinking about when I go see my endocrinologist, does she need to see me in person all the time? Not always, but am I taking my 4-year-old in to get checked out for a cold or something? That might be a different scenario. So can you walk us through kind of who you think most benefits from telehealth and then who it may not be appropriate for?
Absolutely. Like you correctly say, there's variation in the benefits that we can obtain from the more pervasive use of telehealth. And it's by no means a panacea. It doesn't apply everywhere. It's not perfect for everybody. There's a lot of considerations that we need to bring into the reasoning as to whether telehealth is an appropriate solution for every patient. And focusing on elder patients, we have to consider their cognitive limitations, for example, or even more benign things like hearing impairments and other type of limitations that might limit the benefits that could come out of having access to your physician without leaving your home or having to find a means of transportation. So there's certainly benefits for those patients that have maybe less needs of a physical contact with the physician. So the physician cannot examine the patient in person, but to the extent that there is a room for discussion about the patient condition, checking on their vitals, we also need to, I guess, define telehealth. What do we mean when we say telehealth? Is it just a video call, or is it a broader set of devices, which includes wearables and blood pressure cuffs and other devices that could inform the physician on the vitals of the patient? So depending on the condition of the patient, we could have more or less benefits coming out of a telemedicine visit. What I believe is one of the biggest advantages of telehealth is having this possibility to connect with the patient without having to rely on means of transportation, which sometimes elder patients are have more barriers to mobility and to independence to getting to the doctor's office. But your example is very fitting in the sense that sometimes office visits and examinations need to be in a co-located scenario in which the physician can actually examine physically the patient. Another benefit, though, that we have learned about in my work with my co-authors, Tom Feely, Jose Figueroa, and Umar Ikram on the use of telemedicine for older patients, is that sometimes this gives the patient a more comfortable scenario because they are in a comfortable setting that is known to them. And it has proven useful to letting them open up to the physician to share more of what's going on in their lives instead of being in a sterile, unknown, uncomfortable setting in an exam room in a physician's office. Additionally, a lot of physicians have manifested some appreciation for the opportunity to take a little glimpse in the settings in which the patient lives. Do they have a comfortable living room in which they're taking their call? Do they have somebody with them? So there's a lot of soft information that can be gathered by this virtual visit.